The FDA has found its new boogeyman, and it's flexing its muscles. If you thought the war on drugs was universally acknowledged as a complete failure and that it's past its prime, well, think again, folks. Because this time the FDA is setting its sights on 7-hydroxymitragynine, better known as 7-hydroxy, 7-ohm, or 7-OH, a synthesized form of the kratom plant. Let's talk about the future of 7-OH. Back in July, the FDA recommended 7-OH to be classified as a Schedule I drug.
We're issuing a report, an FDA report on 7-OH. Number two, issuing a letter today to the DEA to recommend scheduling above a concentration threshold as a controlled substance. Number three, we are sending a Dear Doctor letter to every physician in the United States warning them about this.
Schedule I is the highest classification of controlled substances. It means that the government believes that a product has high potential for abuse, no accepted medical benefits, and there is no way it can be safely used under medical supervision. If you're caught with a Schedule I substance, it could mean up to a year in prison and thousands in fines. We're talking about heroin, MDMA, LSD, and yes, still cannabis. Users of 7-OH claim it's useful for their ailments, pain and anxiety, and actually provides a useful off-ramp from traditionally addictive opioids. The competitors in the kratom industry, however, and even RFK, call it
gas station heroin,
which I guess is something he'd know about.
I spent 14 years a heroin addict.
7-OH is an atypical mu-opioid receptor agonist. Now that means that it binds to the opioid receptors in our brains responsible for signaling pain relief. It's one of the primary alkaloids that's found in the kratom leaf. The kratom leaf is a Southeast Asian herbal remedy. It's been used for pain relief, for anxiety, and even for opioid recovery. Several firms have been able to create a synthesized and concentrated version of kratom that isolates the 7-OH compound into a pill form. That's what's found for sale in smoke shops, in gas stations, and bodegas across the country. This new version is, still like the kratom powder and the kratom leaf, a partial agonist, meaning that there's a ceiling effect. It binds to the opioid receptors, but because it's not technically an opioid, it only partially activates them. This restricts the immediate dependence issues that you could have with morphine, with fentanyl, and other traditional opioids. But now we turn to the politics, because making something Schedule I out of the gate means outlawing not only possession and manufacturing, but also scientific research, and that is a big deal. The FDA might be the biggest player making noise about rescheduling 7-OH, but similar restrictions and outcries and bans are being discussed or have already been passed in states like Alabama, Arkansas, Connecticut, Wisconsin, Ohio, and most recently in Florida. These bans have been edged along by a campaign that's waged very openly by the leaf kratom industry, which has had its own profits usurped by the growing use of 7-OH. But don't expect too many politicians to understand the differences or similarities between kratom and 7-OH because they're far too eager to ban both. Now, none of this is to say that there should be no rules or no regulations. In fact, it's the complete opposite. Rather than using the full hammer of Schedule I and a new drug war, what about using our institutions and our laws to actually create safer frameworks so we can better control it? That 7-OH is a novel product that warrants scrutiny and oversight and careful guidance is not controversial. It's absolutely necessary, and everyone would agree. But the answer isn't a new ban that will criminalize people overnight and force people to the streets. Regulation is smart policy. Realistically, that means creating a regulatory framework that can govern how and what 7-OH can be sold. Now that means purity testing, transparent labeling for consumers to see, and dosage standards so people understand actually what they're getting, as well as encouraging the clinical research into the therapeutic and medical uses that we know is already happening. And most importantly, implementing those age gates, age restrictions, and consumer education. These things will work much better than criminal penalties and restarting yet another drug war.